let me introduce, to kick us off, our amazing board member, Hannah Hamdi. Hannah?
Hi. Welcome everyone to the second episode of the fall edition of our Teach and Learn Zoom series for Primary Care for All Americans. My name is Hannah Hamdi. I'm a midwifery student at Yale University, an epidemiologist, and a board member of PC4AA. We're tremendously excited to introduce the PC4AA state playbook to our community, to learn about what it entails, and to help everyone learn how to use it. Building momentum for this work is central to building this movement for primary care for all. Our movement is built on a simple idea that everyone should have access to primary and preventative care. So we need people from every zip code and every corner of America to join our effort and make this possible. So thank you to everyone who's joined us from over 40 states and the District of Columbia and more than 322 zip codes. We are building this movement together. We can all feel the crisis in primary care. While we hope that our lawmakers and organizations will make the changes that we need, we know they have not yet and won't come to our rescue. That's why building this movement and building this way forward, neighborhood by neighborhood, community by community, state by state, is so critical. We'll leave time for questions and discussions after our formal program, so we can talk about how you can bring primary care to everyone in your community. And now it is my great pleasure to introduce our moderator for the evening, Patty Armstrong, and to thank our Zoom committee of PC4AA, which organized this Zoom call, and all our presenters, and John Wright, Brian Kaiser, and Patty Armstrong, our ACE Zoom producers. Thank you all so much. Take it away, Patty.
Thank you so much, Hannah. And hi, everyone. I'm Patty Armstrong. I'm a mom and a community collaborator. I'm working with my local community to make this a place where everyone can thrive. And that's part of what makes me so passionate about PC4AA. And I want to thank all of you for coming tonight, understanding that there is a vice presidential debate going on. In just a few minutes, we know that it's important and we want you to be paying attention to these things, but we also know that the work we're doing here tonight is important as well, because being here is part of building a movement. So together we can have the tools we need to build and provide healthcare for people and not for profit in every neighborhood and every community. So while you're here, please take a second and write where you're from in the chat. We'd love to see where you're from, what we are doing here, because we are working together to build this movement. We also want to take a second to think about our friends, our family, colleagues in Florida, Alabama, Georgia, North and South Carolina, and East Tennessee, who have been hit so hard by the recent hurricane, and think about how we can be a part of supporting them. One reminder, we have implemented a policy to create a welcoming environment where everyone can contribute their unique talents and ideas equally. So we are not using professional titles, which is hard for me, but I try to remember often. And we want to work together, be engaged in this work, and value the ideas and commitments of everyone who shows up, which will be part of what builds this movement at the end of the day. Speaking of building this movement, I am super excited about tonight and the panel that we have for you guys. I get to introduce you to our first PC4AA Playbook group. This group has worked hard. I'm really excited for you all to hear about what they've done. Margaret Grady, Sarah Pastor, Andrew Saul, Jim Tamarkin, and Michael Fine will be presenting the work that they pulled together, and will guide us through how we can utilize this playbook and how we can engage well together. Tonight, we are here to both teach and learn from each other. So we'll ask panelists to speak for a few minutes, I'll ask a few questions to get us started, but this is a time for you to ask questions, to engage with this panel that has worked so hard on this information. And you can add those into the chat as you are able to. As a reminder, we are not going to end at our 9 p.m. typical time, 6 p.m. Pacific time. But if you need to drop off to watch the debate, that's okay. But just know someone is recording it somewhere, and it might be plastered all over social media by the time it's over or while it's happening. So there will be plenty of opportunity. The work we are doing here is really important. With that being said, Michael Fine, would you introduce what is this play group and what are we talking about tonight?
Thank you, Patty. As some of you know, my name is Michael Fine. I'm a family doctor, a community organizer, and author, and a public health guy, and president and board chair of Primary Care for All Americans. But tonight, I'm really a member of the Playbooks work group, which has done this amazing work. We're thrilled to be introducing the Primary Care for All Americans State Playbook. The State Playbook provides guidance and direction to our state work groups as they work at the state level to educate the public and lawmakers about how to reorient state government to focus on providing primary care to everyone. There's lots states can and should do. States can make sure they're spending enough on primary care. States can count how many people have a robust primary care relationship. States can fund scholarships for students who commit to primary care. States can and should build new medical schools, new nurse practitioner and PA programs, and fund primary care residencies, and lots of them. States can create standards and funding for nurse practitioner and PA residencies. States can develop pathways for health professions for high school students in all our communities. States can and should retool Medicaid so we get to per person payment for primary care instead of fee-for-service, which has been killing primary care practice for 40 years. And states can convene multi-payer collaboratives to support primary care and primary care practices in new ways. All of these things are important, and our state work groups are designed to help states see the need and act. But remember, the state playbook is just step one. Step two is a local playbook, which will be coming out in November, to help our very cool new local work groups get primary care to everyone, to help us walk on 2 feet, both at the local and at the state level together, at the local level, neighborhood by neighborhood, and community by community. I'm part of a couple of these new local work groups. They're going to change their communities, this nation, and the world. It's incredibly impressive. Many thanks again to the Playbooks work group for all they're doing and have done. My colleague and friend, Margaret Grady, will introduce each person and then introduce the panel. Take it away, Margaret.
Margaret, I think we have you on mute right now. We got to pop you off.
Again, so, and I'll start again. Thank you, Michael. Welcome to everybody. Tonight's panelists are James Tomarkin, former health commissioner of Suffolk County, New York, that managed 70,000 primary care patients in 8 community health centers. We also have Andrew Saul, assistant medical director, Pima County, Arizona Health Department. Andrew has made a career redesigning primary care systems to provide extraordinary care in both rural and urban communities. And Sarah Pasteur, PC4AA board member and a practicing family medicine physician. She currently serves as head of primary care advancement at Elation Health, a primary care focused EHR company. The writing of the playbook was a group effort, and each member made a unique contribution. At the start, we all contributed outlines, and no surprise, landed on one that was pretty close to the one proposed by Michael Fine. Then Kurt Stange, a member of the Playbook work group, took that outline and filled it out a bit, giving us an introduction and a purpose. Everyone added edits to a shared Google Doc, including Brian Kaiser and Greg Mansour. Jim Tomarkin researched the many resources included in the Playbook. And then Judith Steinberg took a nearly complete document and reorganized it, creating important alignment with other national policy documents. And finally, with Sarah Pasteur managing the process, Andy Saul cast his editor's eye over the document, refining the language and giving it polish. I'm so pleased to have this opportunity to thank the members of the work group for their work. So now, Andrew, please give us your take on the problem we're facing, the opportunities, and our approach.
Thank you, Margaret. Good evening, everyone, and thank you to my colleagues on the team. I'm Andrew Saul. I'm a family physician. I've spent 25 years traveling the country working in community health centers. And tonight, I'm reporting to you live from an undisclosed location somewhere on the southwest U.S. border. I assure you, the animals are fine. No one is eating them. I also have a degree in health policy and something called big data. And when you put that three combinations together, a family physician who loves to look at data and knows health policy, it makes insurance companies very, very upset to see you sitting across the table from them. Because at the end of the day, there's anecdotal things people say they make up that drives policy. And when there's no data or made up data, you get really, really bad policy. And as you all know, when politics mixes with healthcare, what could possibly go wrong? Said no one ever. But I want to remind you that your state legislature is the crucible, the crossroads of many, many relevant policies that can impact your neighborhood. And the state legislature can be very responsive if you know how to play the game. And so what you're going to hear from my colleagues tonight are some very easy rules that you too can use to help implement real change in your neighborhood. For me, it's step one, have real data. And the most powerful one you can know is how many people have a regular source of care. And believe it or not, someone's done this data. And in the playbook, you can find where you can get it. You can download it. In my neighborhood, in my state, did you know that 35% of our local people do not have a regular source of care? Stuff like that's very, very powerful. But data by itself can be sterile and it's not going to get you where you need to go. The next step, of course, is you've got to have a face. You have to have a story to tell with that data. Stories allow the data to become human beings, and that is how you build the bridge that can overcome bipartisan divide. Because everyone has a grandma who's impacted by insulin costs, or at least they know a grandma. Everyone has an uncle or knows an uncle, and everyone has a friend, unless you're Ted Cruz. Sorry about that. But realistically, the playbook then talks to you about how to build coalitions. And when you do that, you realize you're not alone. There are other well-meaning people with you, and together you are stronger. The next step, of course, you got to find a policy where you can make a difference, a relevant policy in that area of impact, because complaining might get attention, but when you walk up to a legislator and say, here's something you can do, they're going to pay attention because everyone wants to get stuff done. Michael introduced some ideas like, hey, loan repayment can help you get more primary care docs into our state. Different things you can do to get more local kids into healthcare that will stay put. Because I have yet to find a politician on either side of the aisle who doesn't get really excited about creating jobs and talking about putting people into the healthcare workforce. And recognize also that other people have already done this. Other states are doing this. And some of the best ideas you'll find and some great resources are in this playbook. And of course, the final step is to get in front of a legislator and really make them listen. And that's a big part of the playbook. Learning how to play the game, because there will always be lobbyists and there will always be money, but you have a superpower. We have a superpower, and it goes like this. Hello, Senator. My name is Andrew, and I'm a constituent, and I vote. And my friends and I talk about this, and we vote. And that is the secret of this. Realistically, to walk in there with some possible solutions, cross the bipartisan divide, let them know you're a constituent because they will listen. And when you have to realize this, it's small, it's incremental, it can take years, but over the years, we have seen change, we have brought change. And remember this, that well-meaning people, empowered and working together, can move mountains. And to paraphrase one of my favorite doctors, the arc of history is long, but it bends towards healthcare equity for every member of our community. And with that, I would like to introduce my colleague, Jim Tomarkin.
Thank you, Andrew. I'd like to take a minute or two just to focus on the resources we've provided, and we've provided links to federal, state, and local resources, as well as groups that are nationwide. And we use these, and we want you to use them to help identify problems, assess the status of primary care in your community, find collaborative partners, identify opportunities to intervene, and establish goals. And you can use these for your unique local community. You may have much different goals and problems than your neighbors in your area. And so you may be focusing on problems such as getting more docs to come and work in your area, improving access to care for patients, might be something as simple as improved transportation. We provided bus transportation to our community health centers. We were able to get the bus service to stop right in front of the health center. So there are things like that that these resources will help you access. You may want longer hours. You may want to help solve insurance problems. But at the end of the day, you should use these resources in a unique way to focus on your community and be able to come up with a plan. It can be very elaborate, very simple, depending on your resources, your person power, and the goals that you've established. Having said that, I'd like to turn it back over to Margaret for some closing remarks. Thank you.
Thanks, Jim. Just a few remarks about how to use the playbook. It's not a template. It's not a step-by-step guide. What it does is it identifies 6 necessary actions that states should take to ensure primary care for all. And it identifies strategies linked to resources to help your state work group achieve those actions. So how you use the playbook will depend on the organization of your state work group and the strategic opportunities in your state. So you can dive in at any point. There's no one size fits all, but we do need all of you. So Sarah, tell us how we can take action.
Great. Well, this movement really is one of the most exciting things that has happened in American healthcare in decades, in my opinion. And it's exciting because we finally can all claim agency over our collective healthcare destiny. Instead of wringing our hands and fretting over how awful things are, waiting for someone to do something, we finally can own our power to change the situation ourselves. We don't have to wait for the government or the hospitals or some agency or another, or Amazon or a fairy godmother to hopefully someday eventually come to our rescue and fix the problem. We can get off our butts and fix it ourselves. And that starts with primary care for everyone in America. And who better to fix it than us? It is our health at stake, not just our health, but our wealth, our society, and even our democracy. Now with the state playbook, we finally have a set of strategies and actions for what to do. And I encourage all of you to download the playbook, contact the people in your state who have already signed up, find somebody else who cares about this, set up a first meeting, and start with step 1. The worst part is the first part, but we're all in this together. Just get started. Please don't hesitate to give us feedback on the playbook. We want this to be a living document. We want to know what's working, what's not working, what hacks you've invented that might help others, and we'll continue to update the playbook regularly with new information. Please feel free to share it far and wide. The updates will be behind the same link, so you just go there, get the link, we'll update it as often as quarterly. So I'll end here with one final piece of advice. Find one other person in your state who cares about this, and then proceed until apprehended. Let's make some good trouble.
I love that, Sarah. Michael will often call us the troublemakers of the world. And you know what a great playbook to really get us started on how to make some good trouble and make a good difference. We have lots of questions to discuss. I know I have some questions to ask this group here. If you have a question, hop over to the chat, put it in. Sometimes your question will spur someone else's question. It's a really important thing that we continue to ask. Again, we want this to be a living and active discussion. So with that, let me ask a couple questions of this great group here. So Michael, I'm coming to you first, and I want you to help us to understand what are the 3 overarching goals for state work groups to choose from and focus on?
Great question. And I can answer it quickly and simply because we've got 9 o'clock. We're staring down 9 o'clock. There are 3. The first one is assess the situation. Understand what % of the population has access to robust primary care. We've got a measure in usual source of care. There are probably better measures to be developed yet, like finding a way to actually measure what % of the population is involved. We know that nationally, this is a Commonwealth study showed that only 43% of American adults are actively involved in a robust and longitudinal primary care relationship. Let's drill it down to the state level and let's help you learn it. Learn that number for your own state, talk about it and improve it. So assessment is 1. Number 2 is workforce. We are in a critical primary care workforce shortage. And one of the things that we all have to work on is getting at that workforce shortage by building new training institutions, by building new residencies, and by developing new scholarship programs so our kids can go and become primary care clinicians for free and then have an obligation to practice back home. And the third overarching goal is reimbursement so that primary care practices are fairly and logically paid for their work instead of being nickeled and dimed by fee-for-service.
Thank you very much. All right, my next question is for Andrew and Jim. So it's so much to take on this book, like it's really comprehensive. So how will it ever be possible for any state work group to make meaningful progress? How about let's go over to Andrew first. What do you think?
Recognize it took the US generations to dig this hole. When we started doing fee for service as a way to pay people, it will take us generations to dig out. And so be prepared for the long run. It's incremental, it really is. Keep your eye on the prize, but every year we'd go to our state legislature with 1 or 2 small things and say, this is what we're going to push this year. Throughout the entire time, we're building coalitions, reminding each other that we may not get a hearing this year, but more often than not, at least you get a hearing. You're like, okay, great. Which legislators supported us? Did it get out of the committee? Where do we go next year? And so I began to realize that House Finance committees and certain committees, there are always key people. Once you know who they are, then you figure out who lives in their district and you get them on your coalition and you get them in front of that legislature saying, we the people want to discuss this. Here's why it's important to you. So be prepared for disappointment, but believe it or not, you succeed. It's a very gradual process, but I used to have hair. It's falling out now, but we have seen several bills passed. We have seen loan repayment programs rebuilt, redesigned, funded differently. We've seen great healthcare workforce initiatives established. And sometimes you got to go and found your own nurse practitioner residency. But you bring it to the table, you build those coalitions, and you keep going back and you keep knocking at the door, because if you don't knock, no one's ever going to answer.
Thank you for that. And reminder that, the tortoise and the hare, slow and steady sometimes, but having that long view. It's a marathon, not a sprint. Jim, what about you?
Yeah, I think it's important to recognize that small achievements add up in the long run. Don't overburden yourself with trying to do too much in the beginning. Small achievements show your colleagues, your friends, legislators, that you're a winner and that you've achieved something, and you'll move on to the next goal and achieve that as well. So one step at a time, and achieve whatever you can with whatever resources you have.
Wonderful. Thank you both for that encouragement. All right, so you've convinced me to join a state work group. So Sarah, how do I do that? Who do I call? How do I get started if no one else has started one yet? What's kind of my first step?
Yeah, just go to our website at Primary Care for All Americans and go to the Contact Us page and look for the button that says volunteer. And you just fill out the little form, tell us what state you're in and that you want to volunteer or sign up. And we will put you together with other people from your state and get you started. It's as easy as that.
That does not sound very difficult. And I think, you know, this is part of this process. We talked about it a few sessions ago of the power of two, right? That you just get started a little bit at a time, right? And that we are really building something much more. So Michael, how are you feeling about this?
Well, I think you've got it exactly right. This is about the power of two. Starting with one other person, but starting. Incrementally, yes, but you don't get any place until you get started, and you can get started with one other person, and then you can see things explode. So start a state work group if your state doesn't have one. Start a local work group in your community. We've got about 5 now going around the country, and they're incredibly exciting. Start a state work group if you're in what I call an orphan state, a state that doesn't have a work group yet, or just join a work group near you. As Sarah said, click the volunteer button in the Contact Us website, the Contact Us section of the website, and tell us how you can help. Remember that if we don't all step up together, we get stepped on. So let's reach out to colleagues, family, and friends. And referencing what's going to start in a few minutes on television, this isn't a Republican thing. This isn't a Democratic thing. This is an American thing. We all need great health care in all our communities, and that we're the public in public health, and the time is now.
Well, looking at the time, we promised you that we would wrap things up and join into discussion at 9 o'clock. So please stick around for that. We want to make sure that you know to bring a friend to our next Zoom meeting, which is on October 15th, just 2 weeks from tonight, when we will hear from the very exciting Dr. Ted Long. He's the New York City Health and Hospitals Corporation Senior Vice President. He'll be talking about how New York City Care is helping bring primary care to more New Yorkers. So you can register on our website, primarycareforallamericans.org. Hopefully that's going to be in the chat in just a second. While you're there, please click on donate. We would love to run this on passion and love, but it takes dollars to get things done. So donate. Every little bit helps. And we need and appreciate every single one of you for helping to spread this word and this movement across our nation, because this is healthcare for people and not for profit. We have a survey that we're going to drop into the link right now. We want to hear from you. We want to know how to improve these meetings so that they are something you want to bring your friends and colleagues to have this discussion. And again, our next meeting is on October 15th. With 1 minute to spare, we've got questions and some people that I think are going to be ready to answer them. So we hope you stick around for the next half an hour, but understand that if you have to sign off. One question that I saw, and it caught my eye because it mentioned snacks, is how can we make this rewarding and fun to the short term, in the short term, so volunteers will stick around over time? And Andrew, you answered this. Do you want to, give us the answer that you sort of shared in there and expand on that?
It's just classic motivation 101. People need to know that their work makes a difference. And if they show up, it's going to make things happen. And you say, please, you say, thank you. A trip to the State House. How many people have never set foot in that place? And if in doubt, if you haven't convinced them that their work is making a difference, offer snacks. Or my favorite is meet in the pub, but I can't officially recommend that too publicly.
Yeah, it's a classic community organizing strategy. Take on, identify a big problem, take on a small piece of it, win that small piece, and then have a really big party and start again. Don't forget the really big party part. Bring music, and bring art, and bring invention, and in fact, intentionally make it fun, because that makes it better for everybody.
Absolutely. And I think Julie put it in the comments, relationship is power, right? We show up because we care about people. I loved when Andrew was saying earlier, you have a grandmother or an uncle or a friend, and you know these people. I was remotivated this past week when my coworker came in and told me how her workplace, or how her PCP left the practice. She got reassigned and reassigned again, needed to see them same day, called and said, oh, you were dropped, and never signed back up again. So she had to go to urgent care this week. And I was like, this is exactly what we are fighting against, is this idea that we have to bog down a system because people are burning out, or because there is not the right system there. So that being said, soapbox to the side for a moment, and offering some room for other people to speak up, ask questions. Julie, I also see that you're looking for information on what states this is already happening in. If you have not yet signed up for the newsletter that is being produced and comes out very regularly with information about what's going on in different state groups, again, if you put your information in the volunteer now section, it would be great to keep you connected.
The active state work groups are New York, Massachusetts, and Rhode Island. I don't know if Wayne Altman's still on the call. Maybe you can say a little bit about Massachusetts. There are conversations going on in California, in Texas, and in Colorado. And if you want to join those, let me know and I'll put you in touch with those people.
Good evening, Michael.
Wayne, take it away. Talk about Massachusetts. You've done amazing things.
Well, we're really excited about legislation that we've been working on for 5.5 years. I've been listening to the whole presentation about the playbook. And for us, our playbook started with finding a champion in the state legislature who was a state senator, who, when I met with her, after 5 minutes, she said, stop talking. I got it. Primary care is super important, needs to be the center of our healthcare system. You don't need to convince me of that. I just need to know how to write this legislation. So tell me how to write this legislation, because the devil's in the details, and we'll do it. And 3 years later, we filed legislation in January of 2023, which got out of committee, which we are told is very unusual for the first legislative session for legislation this long and complicated to get out of committee. And the 30-second version of our legislation is that it doubles primary care investment in the state of Massachusetts, switches the payment model for primary care from fee-for-service to a prospective monthly payment, and establishes a primary care trust managed by the state that collects money from the payers and delivers it directly to the practices. We have 12 major endorsements, and we're looking forward to refiling this legislation in the next session in January of 2025 and passing it in this next session. We have a really broad group of stakeholders who are our state work group, who have been working on this. And I guess the last thing I'll say is tomorrow afternoon at 4:30, I'll be meeting with the Secretary of Health and Human Services of the state, the #1 person for healthcare in the state. And we've been trying to get that meeting for about 2 years. So we're really excited about that meeting.
That's awesome, Wayne. I'm really looking forward to it. I also live in the state of Massachusetts, so thank you for your work. We had a great question come out. Tate, I see, there you are. Hi, Tate. Glad to have you on. And you asked if there are any chapters at medical schools or other health professional schools. That's a great question. You've got Dr. Michael, grinning from ear to ear.
Well, we don't have medical school chapters yet, but we'd love to have them. So start one. Or I don't know what state you're in, but we look to people who are in medical school residency, medical school and residency for leadership. This is going to be if this is going to work, it's going to be a movement of young people. So if you want to get involved as a medical student, let us know, and we'll find a way to put you to work and push you to the front, because you have the ideas that we need, and you know the culture that people live in.
Tate, some other advice is find who's running your family medicine affinity group, whatever it's called, your family practice club. Figure out who the attending physician is who sponsors it and get them to attend this meeting. That is probably the quickest way to get the faculty support you will need to start the grassroots thing, and you probably very easily piggyback it off the family medicine group or a pediatrics group or a primary care internal medicine group.
Tate, just out of pure curiosity, are you a student or where are you at school?
Yes, I'm a first-year medical student. Just started 2 months ago at Quinnipiac University in Connecticut. And I'm actually from Arizona, and I recognize Andrew Saul. Yeah, I recognize that name because I went to University of Arizona in Tucson.
Cool. And you should know that there are some conversations going on in New Haven, and I'm hoping they will mature and we'll have a state work group in Connecticut before long.
That'd be great. Thank you.
Wonderful. Thanks for sharing that with us. We love that great encouragement. Pat is going to be starting the Virginia work group. Michael, you have it here officially written down. He's looking for any other takers who are in the Virginia area. So if you have friends or family that would like to spend extra time with Pat, I think he's looking for some friends to join us. Pat, if you are looking for who else is already in your state and signed up, I know on these calls, we see a range of different people and different numbers. Michael, what was the number of people who have, gotten connected to PC4AA through either our website or social media channels? Did we have a number for that?
We're now very close to 800. Okay. And much to my great delight, and in a large part to some work Wayne Altman did, I think we've grown by about 50 to 100 people in the last 2 or 3 weeks. So thanks to Wayne for that, and thanks to all of you who bring somebody else in.
Absolutely. I mean, it's great when we can do this 1 by 1 by 1. It's great when we can do this 100 by 100 by 100. So I think, it takes all of us having these conversations with others. But yes, there is a centralized database that has information about that. But once you start the conversation with Michael and the team, they will get you additional information to get your chapter off the ground. All right, I'm just scrolling up here to see if I missed any questions. If you have a question that you haven't had an opportunity to ask yet.
What if we make like a little documentary about what's going on in Massachusetts? It just feels like this is an interesting moment. I wonder if that legislator would talk to me on camera, and we get some of Wayne's humor and maybe him eating on camera. I don't know. I feel like that would be good. And we capture this moment when it happens. It's just an idea.
great idea. I think Wayne is in a film that's being worked on, as a documentary that's being worked on as we speak. They interviewed him, and actually me as well, on Saturday.
So yeah, on Saturday, David Rosenthal, a primary care internist at Yale, is doing a documentary on primary care crisis, and interviewed Michael in the morning and myself and two other physicians, including Renee Critchlow and Bernard Wigman, in the middle of Boston Common. And we referenced primary care for all Americans several times in our comments. And what was really fun is towards the end of our interview, a quintessentially Boston man with tattoos from knee to ankle on both legs leaned in and was listening to what we were saying for the last 15 minutes. And when we were sort of done, he said, "I think you guys are on the right track. We need more of those primary care doctors." And the cameraman immediately turned over to him, and I really hope he makes the movie, Michael.
Yeah, it sounds like he's going to make the movie.
What was he holding, a giant Dunkin' Donuts coffee cup?
That would have been perfect.
I don't think we're allowed to go outside without holding a Dunkin' Donuts coffee cup around here. No, it's an amazing thing to see, because as soon as you start asking people, and this is, again, this power of relationship, the power of conversation, as soon as you start to say, hey, this is the next step we need to take, come join me, go talk to the legislature, be listening for these things, people are ready. They want it to be happening. So again, this is a great playbook to get started from, a great position to be in, to know what steps we can take next, because I am not medical. I don't know what to do next often. I will always direct you to talk to Michael Fine first.
Or one of the many other great people who are part of Primary Care for All Americans. We got a whole bunch of people who are doing this together.
Absolutely. Does anyone else have a question for this group in particular, or a comment on the workbook or the playbook as you have seen it? I know Brian Kaiser was doing a great job of dropping the playbook right into the chat, as well as offering links to where it can be found. I think someone had said, Denise Wiseman, I don't know if she's still on the call, said earlier, love seeing this within the document. Our North Star is a measure reflecting the one-to-one relationship of every individual with a primary care clinician they know and trust. So, you know, words matter, language matters, and focus matters. And I think that's such a great sentence. Okay, once we review the playbook, what is the best way for us to get our feedback to you? Sarah, do you want to field that question for us?
My best guess, we're going to workshop that answer right now. My best guess is to, maybe we can put a new button on the Contact Us page that will allow you to provide feedback. I'm sorry to say.
I think we can do that. Actually, Brian, if you're still on, I think we could use the administrator at primarycareforallamericans.org email address, and that will get to Brian and myself. Brian, does that make sense from your perspective?
We need to have that on the website, so, you know, because there will be many people who didn't attend this that won't know, so.
We'll get that done.
Yeah, and I saw a thumbs up from Brian, so that should be something we can do. Great job, Catherine. Thank you for asking that question.
There it is.
Admin at primarycareforallamericans.org. Great.
And that gets instantly to Brian and myself, who see all the incoming that way together.
But we'll put it on the website in case you forget.
That's good.
Beautiful. All right.
Sounds like it's time to let everybody go watch the debate.
Looks like that is what is on the docket.
Julie,
Yeah.
could we do a breakout in the future? We actually have a breakout Zoom that we are due for. So we'll try to do that in the next month or two. Great suggestion. What we were doing in the spring was doing breakouts by state work group and by local work group. And I think we're due for another one of those.
Wonderful. Well, thank you guys all so much. We will see you on October 15th, which is just 2 weeks from tonight. Don't forget to register online and invite a friend. Enjoy the debate.
Thanks to everybody. You guys were great.